It's usually associated with men, but heart disease is the #1 killer of women in the United States. One woman is proving that fitness and nutrition can help fight the battle. Nationally known Dr. Miriam Nelson has written several books about heart health, exercise, and nutrition. She joins us this morning with more. Good morning.
Thank you.
Okay, now, I was surprised when I heard that heart disease was the #1 killer. I would have thought it was breast cancer or something more along those lines. I would have never thought heart disease.
Well, in fact, it's about 500,000 women a year die of heart disease, and more women die every year of heart disease than men. And that's been happening since 1984, and this is a message that Sister to Sister is trying to get out, that we are collectively working on to get women's awareness, to get women screened, because heart disease kills 10 times more women than breast cancer.
And why is that? Why are women the target for heart disease?
Well, men and women, both. It is the leading killer of everybody. But with women, we are becoming more sedentary. We are gaining body weight, so the obesity rate really has an impact. And then poor nutrition in terms of not getting enough whole grains and fruits and vegetables, and decreasing the saturated fats and a lot of the processed foods that are coming into our diet. And in our latest book, which came out in May, Strong Women, Strong Hearts, we really try to put all of that information into a program that's easy to follow for women.
Now, a lot of women are on the go, a lot on their plates, families, jobs. I mean, they're doing a lot these days. If they begin to feel tired or certain symptoms, should they not just toss that, chalk that up to, oh, I've been running around a lot, but really stop and pay attention to what's going on?
Very much so. In fact, the symptoms for heart disease for women are quite different than men on average. Many women will actually have a couple of months of where they are just really fatigued. Things are much more difficult, gardening or even changing the sheets on the bed. Everything is more difficult. If you're starting to feel signs like that, you should be going in to see your physician and to get a risk assessment. But every woman should be going in to get a risk assessment so that she really knows what's happening. And so few medical systems even today are saying, you're a woman, you're over the age of 40, you should have a risk assessment. So that is a real mission of Sister to Sister.
Okay, before I get to the point of feeling fatigued, what can I do to change my lifestyle so that I am healthier?
Well, there are really 3 key factors. One is don't smoke. The other is move. You need to move pretty much every day, and you don't have to do planned physical activity. You can walk to do errands, walk the stairs, but hopefully on the weekends and hopefully a couple times during the week, you're walking, you're getting out there and moving, and maybe even breaking a sweat here and there. Get a pedometer that measures your footsteps. Then with nutrition, fruits and vegetables, whole grains, reducing the amount of meats, animal-based meats, increasing the amount of fish, low-fat dairy foods. That's really the ticket, and trying to drop down on those highly processed foods.
Things that you should be able to fit into your life. Dr. Nelson, thank you so much for coming in and spending some time with us. And for more information on Dr. Miriam Nelson or on her books, you can log on to our website at foxbaltimore.com and click